over the years, people have been incriminated in prescribing drugs for themselves without medical advice. In this series, I'll be sharing more light on the understanding of self-medication, the risk involved, impact of laboratory diagnosis before self-medication, and strategies for prevention. You can reach me with the link provided on my YouTube. Now, what is self-medication? Self-medication is an act of self-treating without prescription, treating oneself with non-prescription drugs, or popularly known as over-the-counter drugs or alternative therapies, without regards to healthcare professional advice or consultation. So there is a need to stop self-medication. In order to do this, we need to enlighten the people on the dangers of self-medication. So self-medication is a practice that involves treating oneself with non-prescription drugs, alternative therapies, without regards to health professional advice or consultation. Now, why do you need to understand the topic self-medication? What are the values of understanding self-medication? What is the benefit you can derive when you understand the topic self-medication? Some key reasons why this topic is important are health risk. People take medication without proper guidance. This can lead to incorrect dosage. That is why you see people taking either overdose or underdose. There's usually drug interactions when you do self-medication. When you mix drugs, you don't know how they interact, and as such, it will have adverse drug reaction on you. So this will pose serious health risk to individual. Now there's misdiagnosis and delayed treatment. In misdiagnosis, individuals may misdiagnose their conditions. So they will take drugs hoping this is what is wrong with them, of which it is not. And that will lead to delay seeking proper medical care, which can worsen their health outcome in the long run. So in self-medicating, in self-treating, you will misdiagnose yourself as an individual, and that will lead to improper seeking of medical care, which can alter your health outcome in the long run. Now we have antibiotic resistance. Inappropriate use of antibiotics through self-medications has contributed to growing global concerns of antibiotic resistance. That is, you'll be taking drugs and the drugs will not have effect on you because of what? Over the years, the microorganism or the bacterium which these antibiotics treat have grown to show resistance to these drugs. So you just be self-treating and nothing. So it will worsen your health outcome. Then masking symptoms. Self-medication may mask underlying health conditions because it will usually reduce the symptoms, thereby delaying detection and treatment. Then we have the economic impact. Even though it is cost effective, that is, people tend to go over the counter to buy drugs at cheaper cost or cheaper rate in the short term to alleviate their symptoms, the impact, the toll on the health of the patient, of the individual along may even result to higher cost when there is complication arising from this self-medication. Then we'll have the economic impact also. The economic impact. Then we'll have the public health concerns. The widespread practice of self-medication can impact public health by promoting a culture of self-diagnosis. People no longer go to the hospital or seek health care advice or consultation. What they do, they consult themselves, they prescribe drugs for themselves, and treat themselves. This act diminishes the importance of professional medical advice and supervision. So when you begin to do this, the people or individuals will no longer seek medical advice and supervision due to what? They have mastered the art of self-treating or self-medicating themselves. Then, what are the aims of self-medication? Why do people engage in self-medication? Why do people engage in self-medication? Now, people engage in self-medication in order to alleviate their symptoms. Maybe they're feeling headache, they're feeling fever, or they go over the counter to go and buy drugs, anti-pyrexia drugs, or non-steroidal anti-inflammatory drugs to reduce their pain. Then we'll have the manage minor health issues. Because of the little pains they have, they'll say, oh, this is not worth going to the clinic or health centers for treatment. Then for convenience and cost. So there's usually a lot of inconveniences when you have to visit the doctor and even the cost of doctor treating you. So instead of them going to seek medical attention, they will consider the inconveniences and the cost of getting the doctor's prescription or having the doctors to clerk them. Then, types of self-medication. There are usually many types of self-medication. But for this course, we have 4 types of self-medication. We have the over-the-counter medication. What are over-the-counter medication? These are drugs you get from patent stores. You go over the patent store, they sell drugs for you, where most of these patent store owners are not non-professionals. So they give you their doses or you give the dose by yourself. So most of the most abused drugs in over-the-counters usually are the non-steroidal anti-inflammatory drugs, specifically the acetaminophen, the paracetamol. So people tend to go over the counter to buy drugs to reduce their pains. Then we'll have the herbal remedies. The herbal remedies, those remedies or medicines are medicines whose active remedies or ingredients are from plant parts, such as the roots, the trunk, the flowers, the bark, and so on and so forth. Now, people tend to take this as natural. Because it is natural, it might not have side effect, not knowing that the dosage cannot be quantified. You can't get the dosage of the herbal remedies, and it has so many side effects as well. Then we have the dietary supplements. The dietary supplements include the vitamins, minerals, and herbs also. Vitamins, minerals, and herbs that usually are prescribed to supplement, to add to what is lacking in the system. So most patients, or most people go over to take these drugs without prescription. Then we'll have the home remedies. These are remedies that are made at home. You have such as ginger, turmeric, green tea, garlic, etc. Then what are the impacts of laboratory diagnosis before taking medication or treatment? The laboratory diagnosis before self-medication is important. 1, to ensure accurate identification of the illness or condition. In the laboratory, you are able to get the exact cause of your illness. Then there is proper selection of the most appropriate treatment. Yes, in the laboratory, once your test has been run and the result released, your doctor will be able to impart treatment on you based on the laboratory result, and that will match exactly what is wrong with you, then avoiding of potential complication or adverse reaction. In the laboratory, we are able to investigate the several levels of some drugs, and the potential risk of such drugs. So taking laboratory tests, undergoing laboratory investigation before medication or treatment is very important to avoid all this, in order to get accurate identification of the illness or condition, for proper selection of the most appropriate treatment, avoiding of potential complications or adverse reaction. Then, what are the dangers of self-medication without clinical and laboratory review, without you going to the doctor, for the doctors to know this is what you are experiencing, and for the doctor to send you to the lab for investigation? Now, self-medication without clinical laboratory review can be dangerous, as it may lead to misdiagnosis, because you will be bent on this is what is wrong with you, of which that is not what is wrong with you. Then there's usually delayed treatment of serious conditions, because of what? There will be masking of your condition, which the drugs you take over the counter or the remedies, herbal remedies you have taken, have masked them, and these conditions will just be like underlying conditions that you don't know about. Then there's usually drug interactions, as we have said that most drugs cannot be used together. So when you seek proper advice from your medical personnel, your medical doctor, he is going to tell you this is the drugs that goes with this. This is the drugs that doesn't go with this. Then there's usually adverse drug effect. The effect of drug interactions in your body may alter many things in your body system. So, and as such, it's going to cause more serious condition. So it can mask underlying health issues. There are issues or conditions you will have, health issues you will have, you will not be able to, nobody will know that you will have them, because you are self-treating until you go to the doctor to seek help, and there is a laboratory review. So what are the possible ways of curbing self-medication, of preventing, possible ways to curb self-medication or prevent self-medication? To curb self-medication, it is important to promote public awareness on risk involved. There should be education. So individuals should be encouraged to do regular checkup with healthcare professionals. Then there should be regulations on the sales of over-the-counter medications. Most patent stores are not regulated, and as such they dish out drugs that shouldn't even be exposed to the public. Most of the drugs are even expired without the knowledge of the individuals patronizing them. Then there should be provision of affordable and accessible healthcare services to address people's health concern promptly. Especially the government should be involved in this, to provide affordable and accessible healthcare services, so that people will not be scared away by the cost of the drugs or medications they are taking. Then there should be self-motivation, in which individuals will motivate themselves not to take drugs until they seek medical advice. Then you must learn from other people's mistake. How do you learn from other people's mistake? You have seen the impact of wrong use of drugs on people. You have to learn from there. Why some get complications in the long run, others may not. But for those who get complications, why not learn from them and desist from self-medicating? In conclusion, addressing the topic of self-medication is crucial for promoting safe and effective health care practices, improving health outcomes, and reducing the burden on healthcare systems. Raising of awareness, educating individuals about the risk, and implementing strategies to promote responsible medication use are some of the ways we can mitigate the negative consequences associated with self-medication. This will promote better health for all. Thank you for listening. Don't forget to check my YouTube on some other interesting videos to get some health tips that will be beneficial to you. Thank you.